Hello, my name is Stacy. I'm here with my partners Tony, Elvis, and Rob. The outside. So we are here from the FDNY EMS Academy, which is in Bayside, Queens. We are instructors there, but what we do specifically is we're part of the CPR unit, and we go around the 5 boroughs. It's a free service, and we teach people compression-only CPR. Right? Has anybody ever done a CPR class before in their life? All right. So traditional CPR, the ones that you get certified, is compressions, what we're going to learn today, and the mouth-to-mouth. And they do a few extra things as well, but that's a certification. Our program is not a certification, but it's a good workshop. It's a life-saving skill. At the end of the day, you don't need a certification to save somebody's life. So that's why we go around doing this. We're going to have a short video to show the actual steps of the compressions. I'll show you here live. And we have some mannequins. We'll set them up on the outside. If anybody's interested to practice, you can go ahead and do that when I show you guys. But if you don't do it today, we're going to leave some cards. Our website's on there, and you can book us. It's free. We come to, I don't know, if you're part of a church, an organization, community center, and we'll teach you and your friends and family CPR. Okay? Yeah? Honestly, it depends. It depends. Really? Oh, wow. Try again. Sometimes people do it within 2 weeks, and sometimes I've heard people, it depends on the schedule and the staff, I guess. All right. So the reason we go around doing this, and it's a free service to the 5 boroughs, is early CPR is what's going to save somebody's life, okay? The first minutes of somebody going into cardiac arrest are the most critical minutes, all right? And what usually people do is, you call 911, but by the time an ambulance comes, nobody's really doing anything for various reasons. They're nervous. They don't know what to do. They're panicking, right? So we need people to step in immediately, start compressions immediately in order to give your loved one the best possible chance at survival, okay? So there's a reason we're doing this. So I'm going to start the first video, well, the only video, just to see the actual compressions, and I'll show you and explain everything in detail right after, okay? It's a short clip.
Compressions only CPR. Recognize and act. Studies have shown the most effective tool that increases survival in patients suffering from cardiac arrest is chest compressions. Cardiac arrest is when a person's heart stops beating and they stop breathing. We must be able to identify that a person is in need of chest compressions before we act. Chest compressions keep a person's blood circulating throughout their body. If you witness a person collapse, do something, take action, be 911. This is Alan. Hello. He could be you. A bystander who will help me show you the steps you'll need to take in order to initiate compressions only CPR. CPR saves lives. I learned it, and now you will too. First, check to see if the person is responsive. Do this by tapping the person on both shoulders and shouting continuously like this. Sir, are you okay? Can you hear me? We want to make sure the person is not sleeping. If the person does not respond or wake up, we know this person needs help. Next, immediately send someone to call 911. Point to someone and make sure the person you shout to knows you want them to call 911. If possible, have someone attempt to locate an automated external defibrillator. You, call 911 and get an AED. If no one is around, call 911 yourself. Now, if the person is not breathing or appears only to be gasping, you need to begin chest compressions. Do this by finding the center of the person's chest. The optimal location for chest compressions is in the center of the chest, directly over the sternum. Use the heel of your dominant hand, place the other hand on top like this, and interlock your fingers like this, and begin compressing the chest. Push hard and push fast. Keep your elbows locked. Keep your back straight, and bend at the hips. You need to perform at least 100 compressions per minute. Remember, the key is to push hard and push fast. Great job, Alan. That's exactly how it's done. Now we'll discuss some of the guidelines that should be followed in order to perform the best chest compressions. Compression should be performed on the center of the chest, pressing down hard and fast, approximately 2 inches deep for adults, which is about halfway down on the chest. The victim must be on the floor when you do this. You may feel cracking under the person's skin due to ribs being broken. This is a common occurrence and should not deter you from continuing compressions. Broken ribs heal, but stopping compressions can ensure death. The chest should be allowed to fully recoil or allowed to return to its normal shape between each compression. Keep pressing on the chest and attempt to maintain a rate of at least 100 per minute. The lyrics to the song, Let's Get It Started, and many other songs follow a tempo of 100 beats per minute. Keep pressing on the chest until another person that is trained in CPR takes over or there are signs of life.
A little bit more detailed so you understand as to why we're doing certain things. We're not gonna just jump on somebody's chest and start compressing just because they look like they passed out, right? Somebody who needs CPR has to be in something called cardiac arrest, all right? And cardiac arrest just means that the heart has stopped. All right, thanks. That the heart has stopped, all right? And the breathing has stopped. We only do CPR on people who are dead, right? If my heart stops and my breathing stops, what does that make me? Dead, right? It sounds crazy, but we are trying to revive them. That's what CPR means. We're trying to revive them. So we have to check for that. So the first thing we're gonna do is if somebody drops, right? And when I say somebody, yes, maybe you might be able to help a stranger at some point in life, but the reality is, hey, that was me. Like I'm famous. So the reality is, if you ever have to do CPR in your lifetime, which hopefully you never have to, it'll be on somebody that you know, all right? Over 70% of cardiac arrests happen at home, all right? So first step, if somebody's on the floor where they shouldn't be, you wanna try to wake them up. So you're gonna take both your hands and hit both their shoulders, tap them pretty hard. Yeah, yeah. Well, tap hard. If you do a little light tap, nobody's gonna feel that. You wanna see if they wake up or make a noise, something, right? If they do not respond, your next step is to call 911. If you're by yourself, use your cell phone, put it on speaker, and the dispatcher will guide you. The dispatcher will guide you through, right? But if you're in a group setting, tell somebody to call 911 for you. But don't just yell, hey, somebody call 911. People are videotaping nowadays, everything. People think maybe the person behind them is gonna call 911. So point to somebody and give them the responsibility. Like, hey, you with the MSK shirt, call 911, right? Just something so they know, oh, that's me, I'm wearing that, you know? And have them acknowledge you. Also, I'm gonna go over this afterwards. If you know there's an AED available, and I'll explain afterwards where they're usually available, you're gonna ask somebody to go get you an AED as well. You don't have to open it now. Okay. Yeah.
There's one in this building when you first come in.
Okay. I'll explain to you. You can put it under. I'll explain to you afterwards where those are located. But also ask somebody to get you an AED. The CPR, in addition with the AED, is gonna give that person the best possible chance. Okay. After you call 911, the dispatcher is also gonna ask you, is this person awake and breathing? They say along those lines. Or regardless, you should also always check if this person's alive, if they're breathing. In the movies or if people who have done CPR classes before, that's the point where we check for the pulse, right? We check for the pulse and breathing at the same time. For our class, just check for the breathing. Checking for a pulse is very difficult, especially if you're panicking, especially if you're not trained to do it, or if you're not doing it on a daily basis. So look at their chest. If your chest is rising and falling, that means you're alive and breathing, right? If their chest is not rising and falling, they're not breathing, and that's when we do compressions. So if there's a word called agonal breathing. That's a gasping breath. Even if you see somebody gasping, not hyperventilating, like a gasp, that is also a time to do CPR, okay? That means they're on their way out, and we need to start compressions immediately. So you're gonna take the heel of your hand and find the center of that person's chest, so the sternum, that flat bone in the middle of our chest. Your other hand's gonna come over, you're gonna interlock your fingers. Normally would be on the floor, right? Even if somebody's in bed, on a couch, on a chair, you find them unresponsive, bring them down to the floor. If we need to do CPR, they need to be on a firm surface, okay? Something firm underneath their back. So the floor is the best. Hey. Yeah.
Sorry. When my father passed, they had me bring him off the bed onto the floor, and I wasn't sure why they needed it, because I mean he was on a flat surface. And then while I was on the phone with them, because my mom was short, I was doing the chest compressions while on the phone, and my brother was doing them mouth to mouth. Didn't help, but at the time when you were saying about the tapping shoulder, they didn't tell me to do that or check for the breathing or anything like that. So it's like I was confused on what really to do. So I'm trying not to go what I see on TV versus what they what the person on the phone is telling me. So I'm just trying to ignore the TV and just rely on what they're saying. And it was struggling, because it's like not knowing how much pressure to put down and how many times, like you don't think like how many times is 100 times? So it's like it's just you wind up getting confused but it was thankful to the paramedic that was on the phone or the person that was on the phone told me to okay now stop doing the chest compressions, then do the mouth to mouth because I didn't know when to stop. So it was helpful though.
Thanks for sharing the story. That's the whole point of when when you're on the phone with the dispatcher, they will guide you through things. There's protocols even over the phone. And until we get there, they will guide you through everything.
If the person is very big and they're on the bed and you're by yourself and you can't take them off, you can always put a board underneath their back. Okay?
So, where was I? Forgot. Oh yeah, we were talking about because if you're on the mattress and you're doing CPR, you're gonna be bouncing around, right? You want to give that person the best quality CPR. So, you're gonna interlock your fingers. You're gonna straighten out your elbows, right? Like I said, on the floor, it's gonna look more efficient, and you're gonna compress 2 inches down, which is nobody carries a ruler right around with them. It's always gonna be halfway down the person's chest. So the bigger the person, the more harder you're gonna have to push. And a lot of people are always afraid, like, I don't want to push too hard, I'm gonna hurt them. Most of the time, people don't push hard enough. You need to push hard. Okay? Yep.
When they were showing the video, they were saying that something about keeping the elbows locked. What does that mean?
Your elbows have to be completely locked because what you're doing is you're really moving with your waist. You're not moving with your arms bending up and down. You want to move with your whole body because we need all that pressure. Okay? And we are doing between 100 to 120 compressions a minute. That's a lot, right? That's about 2 compressions a second. And that's impossible to calculate in your head. So they come up, there's songs, right? If you Google CPR songs, there's a whole bunch of them. One of the most famous ones is Staying Alive. And which one? Okay. And when we teach students, they do Baby Shark. I don't know if anybody knows that song, but that's a CPR song too. So if you keep that tune in your head, you'll stay in the proper tempo and you're gonna be doing the correct amount of compressions. Because when you're nervous, what happens? You wanna go quicker. You think if I go quicker, I'm gonna save them quicker. But you have to keep a steady pace, okay? So let's say you're doing a good job, you're doing CPR, we are not there yet, and this person starts breathing again. You don't wanna leave them flat on their back. If fluids come up, anything comes up, they're gonna end up choking on it. So we're gonna put them in something called the recovery position. So one hand goes on the shoulder, one hand on the waist, and you roll them onto their side. Either side is fine. Just obviously if you roll them closer to you, towards you, which is easier. If they vomit, just don't drop them, right? Because they're gonna vomit on your Vans. But I guess that's the least of our problems, right? You're just happy that person's alive. So always keep an eye on their chest when you have them in recovery position because they might go back into cardiac arrest, which at that point you're gonna put them back down and continue compressions, okay? Simple, right?
What happens like if the person who needs the CPR has like obstructed airways or like something that you can't visibly see, but like there's something in their mouth like vomit or something? Like what do you do in that moment if you need to do the mouth to mouth?
So I wouldn't recommend doing mouth to mouth with vomit in somebody. The reality, so like I said, what we teach is just compression only. If you don't know how to do mouth to mouth, if you were not trained for it, don't. Okay? Straight compressions is good enough until we get there. Now, if you know how to do the mouth to mouth and do the breathing, and it's your family member, you don't care if you have a barrier device or anything like that, the best thing you can, because we have suction devices, we always have devices for things. The best thing you can possibly maybe do is maybe try to turn them over a little bit, maybe drain out. But at that point, the dispatcher will guide you through if you tell him that information or him or her that information. Okay? So, anybody wanted to practice? If anybody wants to practice, come outside. Can you get some mannequins?
Oh, yeah?
Can you get some mannequins?
We got some people on the practice. Put some on.
What? No. No, we're not doing this. We're not interrupting. Huh? No, I'm gonna do the ED. Yeah. All right. So while they're doing the practice, I'm gonna show you how to use the AED, okay, and where it's located. So an AED stands for Automated External Defibrillator, okay? So anybody heard of a pacemaker before? Yeah. Some people have. That's an internal defibrillator. This is an external defibrillator, okay? So again, this is only used on people who are in cardiac arrest. It doesn't replace CPR. we put it together if available. They're not always available, right? When you call 911, we bring one to every call because you never know what happens. People don't usually have this at home. You're able to purchase if you'd like to. They don't. It's not only for medical personnel, but normally people don't carry these at home. So these are located. They have to be at all schools, private or public. There has to be AEDs there. When the students are in teams, whether they, practice games, the coach always has to have one with them. And why is that? Because cardiac arrest is for all ages, right? It happens to younger children, it happens to the elderly, it happens to middle age, all ages, right? You never know what's going on. It can either be something medical or it can be something traumatic, maybe a bad car accident. Somebody goes into cardiac arrest, right? The heart stops. So these always, not always, but some restaurants have them. They don't have to have them, but some do. Anything that is open to the public, like malls, stadiums, concert halls, like Madison Square Garden, for example, they have to have an AED available. All right. Anything open to the public where there's a lot of people, they have to have this. Public parks, right? Sometimes the place is so huge you really don't know where it might be, but that's why we say tell somebody go get one for you if available. Okay. So these machines, say it again. Yep. The airplanes, and there's always staff on there that are CPR certified as well. So these are extremely easy to use, okay? They might look a little bit different, but they all do exactly the same thing. If you're gonna remember anything from this device, is turn it on. Once you get it, turn it on because it's gonna tell you step by step what to do, all right? So ours, we have a green button on top, which they're all gonna be green. It's an on and off button, but once you turn it on, don't turn it off, just let it go. The bottom one is an orange button, that's a shock button. And only when that button is flashing are you able to shock somebody. And in the middle here where the square is, on real AEDs, most of them, there's a screen. So whatever it's telling you to do, it'll be showing you pictures as well, okay? So it's basically gonna guide you through how to properly place the AED on somebody. So the AED consists of AED pads. So the pads have our stickers. Basically, anybody ever did an EKG before? Something similar, but it's just two pads. They have pictures on them of how our mannequin looks, like half a body, and there's arrows. So the arrows will tell you where to place the pads on the chest. And this is the proper placement. Doesn't have to be exact, just in this area and in this area, okay? So I guess now we'll turn on the AED so you guys can see how it works. Mm-hmm. Maybe take it off completely, though.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
So the first step, it said apply the pads. And if you didn't hear it, or you're nervous, or it's too loud, this machine keeps repeating itself.
Apply pads. Plug in connector.
So the connector is going to be flashing for you. There's no other place you can plug it in, but it's going to flash for you so you can do it as quickly and as effectively as possible.
Analyzing heart rhythm. Do not touch the patient.
At that point, if anybody's near the patient, touching the patient, back up. Tell them to clear.
Charging. Stay clear of patient.
Everybody clear, clear.
Deliver shock now. Press the orange button now.
So the machine is gonna start, charge up, start flashing, but before you press that button, look at the patient again, yell clear, and then you're gonna press it.
Clear, clear, everybody clear. I'm clear, everybody's clear.
Shock delivered. Paused. If no signs of circulation, start CPR.
So that, it said if no signs of circulation, start CPR. That means look at them. Are they breathing? Are they moving? Any signs of life? If not, we're continuing compressions. Okay? Now, if they are breathing after that shock and they're showing signs of life, we're going to roll them over and put them in recovery position, like I said before. Okay? It's as simple as that. The hardest part of all of this is staying calm. It's the machine tells you exactly what to do. The skill itself, the CPR, is very simple skill. It's just you gotta keep calm, the best you can, obviously, because when it's your family member, it's hard to keep calm. All right. Any questions on the actual CPR that we talked about before or the AED? Yep. Inside their body, no. Or even sometimes people have piercings. Oh, so the question was if somebody has anything electronic inside their body, right? Would it be harmful for them to shock that person? And the answer is no. So have people that have pacemakers. That's an electronic. We still have to use this device if they're in cardiac arrest. All right, there's no contraindication to using this device or CPR. All right, even on the external of the body. So one thing I didn't mention before, when using the AED, waist up, everything has to come off, and that's the bra included. All right, we don't want nothing interfering with us placing the pads properly or analyzing the heart. All right, we don't want anything interfering with that. The pads have to stick on the skin. Okay, let's say somebody has a very hairy chest. These pads might not stick to the chest properly. So the AEDs usually come with a razor. And that razor is to shave their chest. We're not shaving their whole body, all right, and their legs. Just these two spots, just so we can be able to place the pads on the two sections. Oh.
Do not touch the patient.
So this machine reanalyzes every 2 minutes. So let's say you're still doing CPR, and let me close it. In 2 minutes, it'll tell you again, analyzing the heart, stop touching the patient, and check to see if this person needs to be shocked or not. All right? Sometimes you might not shock a person not once until we get there, or you might shock them 3 times or 4 times until we get there. Okay? Yep.
The maximum amount of times that you can shock a person.
So the question is, what is the maximum number of times? There is no maximum. If the machine's telling you to shock, you're going to shock. Hopefully you're not there for too long. If you call 911, we should be there fast. This call for us, a cardiac arrest, is priority 1. If somebody's not breathing, that's the priority. We have to get there as quick as possible. But even if we get there the best time possible, 5 minutes, let's say we get there within 5 minutes, the brain cells begin to die within 4 to 5 minutes without circulation. So that's how quickly the brain cells start to die. That's why we go around teaching compression, at least compression only CPR. When you're pressing on somebody's chest, you're circulating their blood, right? And it's going to the vital organs. After once you get into cardiac arrest, within 4 to 5 minutes, your brain cells begin to die without circulation in the body. Okay, and they're not coming back. Those cells, once they die, you can't get them back. All right, so that's why it's so important we start early. Early CPR is what's gonna save people's lives. I don't know if anybody watches football. Was it a year ago or 2 years ago when the NFL player went into cardiac arrest? He's young, athletic, right? In shape, but it wasn't a medical for him, right? It was a trauma. The ball hit him. So the ball hit him the wrong way and he went into cardiac arrest. What saved him is early CPR and the early use of the AED. That's what saved him. And he got shocked 2 times, right? Yeah, he came back, thankfully. Yep. So the question is there any after effects of using the AED on a person? Hopefully come back to life, which is a positive after effect, right? Maybe sometimes a little burn, right? But nothing major, nothing major. I don't want to say it's major, but you saw how hard he was compressing, right? In the middle of the chest. Do you think maybe the ribs might break? That's not the goal. The goal is not to break the ribs, but it might happen, right? Maybe somebody has a bone problem. They're elderly, or what? There's a million reasons why somebody's bones might be brittle. You keep going. You keep going. If you stop compressions because you're afraid, like, oh my God, I broke their ribs. I killed them. Remember what I said? They're dead already, number 1. But number 2, if you stop compressions, you're not giving them any chance at that point. They're just gonna stay dead. Yep.
As we were practicing out there, like, I mean, even now, like, I could still feel pain in my back. As a person that's doing the compressions on the person, you said we're not supposed to stop, but what happens if the person who's doing the chest compressions and, they get tired, they get winded, or a back injury occurs? What do we do in that moment?
So, great question. Everybody heard it, right? I was going to repeat it, but I forgot you had the microphone. So, if you're exhausted, so this is unlimited, the CPR, right? You go until hopefully they wake up. You go until we arrive, or any help arrives, really. If somebody's just passing by and they're willing to help you, even if they've never done this before, show them. Put your hands here, right? I showed you in like 2 seconds where to place the hands. Put your hands here and keep pushing. Take a break. But if you're by yourself, you don't want to be the next one on the floor. Give yourself a break. People have medical conditions. People have, or you just get exhausted. It's a tiring skill. Give yourself a break. If you're able to go back and do compressions, great. If not, just wait for us to come. Make sure you had call 911. Yep.
I'm on the board at my senior center, and unfortunately, many of my seniors could not come out for an event like this. So my question is, would you guys be willing and able to come out to my senior center? Thank you.
So
We'll come out to anybody, anywhere in the 5 boroughs, free of charge. Get us 10 people or more in a space to do it in. We'll do the whole 45-minute class in practice.
So we're gonna leave some cards here if you want to pick it up. But there's a website. I know everything's done by website nowadays, but there's a website. It's FDNYSmart.org, and you go to Community Affairs and you look for the CPR unit. The other option is Fire Safety, where they talk about fire safety. You can book that too. They're both free services, and we will come out to anywhere in the 5 boroughs and teach everyone CPR, and it's free. Yep. Let me give you the microphone.
Okay, do y'all perform CPR when a person has a stroke?
So the question is, do we perform CPR on somebody who has a stroke? If somebody had a stroke and they went into cardiac arrest, they're not breathing, yes, we will. But we don't perform CPR just because somebody is having a stroke. If somebody's having a stroke, doesn't mean automatically they stop breathing. They can still be alive. Right? Same thing goes for a heart attack. Just because somebody's having a heart attack doesn't mean that automatically they're in cardiac arrest. It's just it's a medical emergency, but they're still alive. They're breathing. Some people, patients that I've had, they were having a heart attack, but they didn't even realize until we had put the EKG on their chest. So the only time we do CPR is you have to make sure that they're not breathing. If they're not breathing, most likely they are not alive. And I say most likely is because normally we check the pulse at the same time too. So you're not going to be in this situation checking the pulse because we didn't show you that. But if somebody's not breathing, inevitably their pulse is going to stop if it's not already stopped. Okay? Yep.
When you do the pulse, you do it neck and you do it here also?
So for CPR, we check the carotid pulse and the neck. That's the pulse we look for. Any other questions? Yep. Oh, you got it.
Someone's not breathing, they're automatically dead if they're not breathing?
Technically, no. I can't say technically, if somebody's not breathing and their heart has stopped, technically in that moment they are dead. Now, when it comes to just breathing, if they just stop breathing, we are going to assume yes in this course that we're doing. Because if they're not breathing, and if 911 is not there to help assist with oxygen, with everything, they will stop. Their heart will stop at the same time, or not the same time, or soon after that. So we are going to still start compressions early if their chest is not rising. Okay. This is for our course. Now, if you take the certification, they're going to teach you check for pulse and breathing at the same time.
American,
the American Heart Association and the
Okay.
Red Cross. Yeah. So if anybody is interested in doing a certification class, it's the Red Cross or the American Heart Association. Usually you go, oh, you guys are Red Cross? I didn't know that, right? This is what I usually say. You go on the website, you put the zip code, and you see who's holding classes in your neighborhood or wherever you want to do the classes. Okay. Any other questions? No? Okay. Yeah.
When you doing the CPR on them, and you would tap them and say, "Could you hear me?" You do all that too. I think I had this class maybe about 10 times.
Okay.
Uh-huh.
Yeah. Normally it's like, hey, are you
Right.
okay? Are you all right?
Yeah.
Yeah. You're trying to wake them up any way
Right.
possible, whether you're talking to them, hitting them on their shoulders, Yep.
So it's not the same for somebody. It's not the same for somebody who's choking, right?
Choking? No. Somebody who's choking may end up in cardiac arrest because the object has not come out, but that's when we do the abdominal thrust. It used to be called Heimlich maneuver, but I think they changed it now to abdominal thrust. Oh no, we don't teach the choking. We don't teach anything other than chest compressions. I mean, I can practice on my partner over here, maybe. He just ate lunch. I don't think anybody wants that.
Okay, I think we have time for one final question, if there is one.
Anybody else? No? You look like you want to ask something.
She wanted to know what is an abdominal thrust.
It's the Heimlich maneuver. The Heimlich, when somebody's choking, you just saw in the movies when they. So basically, it's when you do the Heimlich on somebody, you're basically under their diaphragm, and you're kind of pushing in and up at the same time, because you're trying to push that air to bring that object out. Hopefully. Yeah, but I have to look it up. But I'm pretty sure somebody had told me when we were in the academy that if you guys know, they don't call it the Heimlich anymore because there was a problem with the name or whatever, and now it's called the abdominal thrust. It's literally just explaining the Heimlich maneuver is you're hitting the abdomen and pushing upwards. Yeah. Anybody else? Good? All right. Thank you so much for having us. I hope you guys learned.
Okay, let's give the FDNY round of applause for a fantastic demonstration. Thank you. Thank you.
Enjoy the rest of your, evening.